Well, hello to every one of you. This is Tokitus Official, another live talk. My name is A.G. Ilbegi with collaboration with Tokitus.com, and I'll be your host today. Today we'll be talking with two individuals, and not just one, but two. And this is all regarding Introduction to Neuroscience. Now, one thing I'd like to add before we start, don't get intimidated by the name science or neuroscience. What we want to do, we want to simplify this and see how, what happens physically in a human, maybe brain, while actively wanting to do something about it, especially nowadays in this time of pressure. And here there are enough information that will be given to you to find out more about this, and I think this should be very interesting. The two individuals, they come from, they're co-founders of Integrative Neuroscience, and they'll let you know more about this, but it's really a pleasure for me to talk to them today. And here I would like to invite them to come on in. 1 and 2, and there's counting down. I gave him the okay. Oh, there you go. Hello.
Hi there. How are
Hello.
you?
Hello. Very nice to meet you.
Very nice meeting you too. It's very
Nice to
exciting
meet
to be
you
here
as
with you.
well.
Great. So I just did a brief kind of an introduction, very, very general. And I would like you to maybe introduce yourself and then naturally then say a little bit about the INA, and just let the viewers know. What I already said earlier was that we try to keep this, so to say, so it's a very understandable. We don't want to get too technical about it because I think it's a fascinating subject. For me, it always was. If I would, come to a new life, I would become a neuroscientist or a neurosurgeon myself. So really, it does really get my attention. So please, we have Emilia, if I say correctly the name?
Emile, yeah.
Emile, yes. And Laura, please, the floor is yours, so to say.
Thank you. So I don't know, I would firstly like to thank you for being able to actually have a conversation tonight with you and Emile, and just a brief introduction. So I'm Laura. I'm doing my PhD currently in neuroscience, and yeah, I'm a co-founder and a co-director of Integrative Neuroscience Association, which we've established with Emile just over half a year ago.
Yeah,
Okay.
and I'm Emile. I'm currently a psychiatry doctoral student at Oxford, coming from a background of mostly neuroscience and anthropology. And the reason kind of Laura and I were interested in creating this Integrative Neuroscience Association is very similar to the goals you discussed here. We aim to be kind of a bridge between the neuroscience, the science focusing on brain studies, and bringing it closer to people, both from like an educational standpoint, as well as from a clinical perspective. And an important aspect of our work is also the anti-stigma and the advocacy work we do in order to reduce stigma surrounding mental illness, but also to increase access for people with disabilities and neurodiverse conditions.
That was fantastic. I'm in awe. Thank you so much. That was a wonderful introduction from both of you. But one thing which I did was also, I actually went to the website and I really liked it a lot, especially the part where it says close-up science, where there are these articles or blogs and so forth.
Yeah.
I think they're fantastic. And I would really recommend people to go to your website and really look at that, because it really brings it down to the point, and also from a lot of how do you say, people having questions and asking certain things, but showing them and giving them in simple words, but with a background of research.
Exactly.
And that's one thing I tell a lot of people, especially now in the it's kind of era of internet where everybody goes and finds, and they say scientists say, a research says, yeah, which research, from who?
Yeah, this was actually exactly our aim, to actually bring the science, bring what the scientists are doing in the labs, because there's a lot of misconception about what a scientist is and what we do, and people don't really know. The information may be lost, and there's such an abundance of everything on the internet. And what we're trying to do is really to put the scientific and difficult terms into the lay people language, and to make science actually acceptable and like easy to grasp, and just drink with a cup of coffee and not really strain your mind too much.
That's right. And one thing I also said, I bring it down to a very normal, simple understanding. When they say science, okay, science is, I don't know, about a couple of hundred years maximum. That's how old it is. But we've improved quite a bit. But science is one thing, which I always say, it's a work in progress. So if it's science says this now, okay, take it with a grain of salt, unless it's really backed up, peer review, and so on and so forth, and the redundancy in theories and so forth that have been examined. Then we say, okay, this could be the truth, it could be the fact. With our technology and knowledge that we know today, a certain technology and something may come up later on, and you're like, whoa, wait a minute. Just like what happened to physics. You know, before they say physics, this is it is, energy is energy, something for itself. Matter is matter, they have nothing in common. And we found out everything's interconnected, and everything is through energy. Anyway, just getting that out of my mind, we can start off with the first thing. What is INA? I mean, you said kind of it. And the philosophy, I think you already told us approximately what it is. And the field that you're working, what does it... What were you thinking by achieving, other than what you just tell me? I mean, further steps, because it started new, and there are several different platforms as well, which I'm very happy that they do exist, with scientists, with professors, and so forth, where they try to destigmatize, as you say, this thing about the neuroscience, and connecting it actually to what we are as human beings too, which we're not that much aware of. But the brain has a huge part in this. And I think the past 10, 15 years, a lot of things have been sort of demystified, so to say. And before that, the brain was just a gray area. Now we're finding more. And what are the newest things that, also from your side, that so to say, it gave you the motivation to do what you're doing? Because you're just at the beginning, so to say, because this is going to take off. I mean, doing it properly is going to take off. So what do you have to say to that, and what are you expecting to achieve also by this?
So maybe I'd start first. So I think it actually is in our name. It's the name that it stands, Integrative Neuroscience Association. So we want neuroscience to be more integrative. We want to have people from psychology, from psychiatry, from neuroscience, from fundamental neuroscience, people that are working with really mice models, and actually to work together to transmit that information between them and actually then put it out to the people. So it's about the integration of the psychological well-being and the scientific evidence that actually comes from the studies and being applicated. I think it's one of the strongest points, but Emile, I'm sure has something to add as well.
I mean, I'm sure everything that Laura said is a very big part of our goal, but kind of reacting to an earlier statement you made is that our knowledge is always limited by, one, the tools that we can use in order to investigate the brain, but two, our ability to understand the information output by those tools. So what we believe in is this holistic perception of human well-being. So we do want to bring in insights from psychiatry, insights from neuroscience, insights from psychology, and kind of bring them in together. But another important aspect is also to bring them to clinical practices as well, to the extent that we can apply them at this point in time. And so we are also very open to the fact that the things that we might choose to implement or choose to advocate for might change with time, might change with technology, but we want to be the most up-to-date, the most scientifically validated at this point in time, and obviously emphasizing safety in all of the treatments and all of the information that we communicate.
Okay, wonderful. Now, just straightforward, what is it that you can briefly say about what we thought about the brain and what we know about the brain to date?
The most straightforward example that I think a lot of people not familiar with brain studies might be surprised to hear is that for a long time it was believed that different parts of the brain are responsible for different things kind of exclusively. Exactly. And something that has really changed in the way we understand the brain is that most of the brain is responsible for most of the things we do. And yes, there are predominant functions in particular parts of the brain, but it is involved pretty much all the time. And the often heard myth that you are only using 10% of your brain is completely false as well, because you need all of your brain to be working all the time. It's kind of the most straightforward example of these.
Yeah. There's also another thing that scientists and a lot of people thought is that the brain we're born with is the brain we stick with throughout the life, but it's actually not true, because neuroplasticity, that's actually the thing, the changing of our brain constantly is happening throughout life, and that actually allows us to learn new things, learn new habits, and allows us to progress in life. So that's another big thing that was really busted with neuroscientific research and evidence.
I understand. One thing which, I mean, I have a couple of questions here, but I think we'll just go through them nicely. We bridge them, so to say. The one thing that was also said, I don't know how true that is, but it was said that between the conscious and what we call the unconscious or the subconscious, you know, we have to label it, even though we don't know what the hell it means. Okay. So we have to label it. Say, this is conscious when you're conscious. Even there are questions about what is consciousness, which is a huge thing anyway. But when we are there in the physical realm, so to say, in this time-space reality, as a person at the now, so to say, and we get this kind of an information coming in from what we see, smell, taste, whatever, from our sensory system that we have, okay? I mean, we say there's 5, but we find out there's a lot more than that. But let's stick to the 5. What happens is they say the amount of information that you actually get consciously is a fragment, a really low fragment of actually the amount of data that your brain and your system is actually processing, that you're not aware of, you're not conscious of, and so forth. What do you say to that?
Laura, do you want to react to this?
I don't know.
Or, I mean, I'm happy to get started. Yeah, I mean, that's definitely correct. It is true that our brains absorb much more information than we are consciously aware of absorbing. I think it is very interesting, and I am looking forward to having this conversation actually with Ali, who I know is a psychotherapist, probably from the Viennese school, under the Freudian education as well, which is interesting because for those of you in the audience who are not very familiar, but it was one of the ideas accredited or associated with Freud of the idea of the big unconscious, something looming in the background that has been reinterpreted in many different contexts. But what we know from neuroscience is that there is definitely unconscious information that is being processed in the brain, but it is not necessarily negative or it's not necessarily scary, and we shouldn't be afraid of talking about the unconscious. It doesn't necessarily hold secrets per se, it just holds things about ourselves that we might not necessarily be consciously aware of things happening in the background. And one of the great examples, I think, that really set it forward for me is the example of the superior colliculus, which is a structure in our brain, and the visual system. So for example, the visual system in the brain is responsible broadly for seeing. So whatever you see around you, that's the visual system. And then there's this other part in the brain called the superior colliculus, which is much deeper in the brain, and it's a much more primitive structure in the brain. And so, for example, what they noticed is that blind people, when they walk down the road, they still are able to avoid different things coming up in their path. And they don't really understand why, because technically their visual system is not operating. They're not even aware that they're changing their path trajectory. But what this very primitive part of our brain that is seen in monkeys, that is seen in rodents, is actually active during that time. So this is a type of unconscious information. We are operating through our life differently than we would otherwise without that part's functioning, but we are not aware of it at all. And I think this is just most straightforward because it is visual, but obviously it happens at the psychological level and at the conscious and kind of decision-making level all the time.
I would just like to add to that me coming also from psychology and cognitive neuroscience background is that it's very easy kind of maybe to divide our brain, our consciousness and subconsciousness, sometimes into those two parts. So like the conscious brain is like this deliberate system, this slow thinking system that really takes time. And then subconsciousness could be referred to something that is predictive, that is like habitual, that we do without thinking. So it's just like an easy way maybe to conceptualize this, although it's a long debate and still very difficult topic to talk about how to even measure consciousness. And the next question is whether there's a need to actually measure it.
Okay. Thank you for the clear information that you just gave, and I hope that was clear for everybody else. I mean, it was pretty straightforward for me. But one thing, Emilia, I have to say the name correctly. I always maybe stop and say Emilia.
It's Emile, but honestly, feel free
Emile.
to go by M.
Okay.
I have
Emile
recovered.
is good. M. Okay. Emile. Okay. Emile. One thing that you also just said right now, it's that made me think. There is quite a bit that we don't know, and it's good to say that you don't know. I mean, I'm telling you that to everyone. It's good to say we know, and I think, who was it, Socrates or something said, now I come to the point that I know nothing, which makes him very wise, actually, you know, to say that you don't know. Those people who say, yeah, I know, I got it, yeah, this is this and that, think again, please, okay? And now the thing with the brain itself, it's that there is this, I think maybe you've heard of Dr. Bruce Lipton. He also came out, he's very, very active in giving information also from the scientific side. He was, I think he's a scientist, but looking for genes and so forth. And there he found in the 70s, he found that, hey, there is something else. This is not it, okay? Even from that molecular level. And then later on now, and because before we thought, everything is in here. Everything stays in, okay? Nothing goes out. And with the EEG, they basically put it there, okay, so they measure the wavelengths and so on and so forth, because it has to get stuck to it, okay? And with my head, it's very nice. You can see it very clearly what I'm doing with my head, because it's, you know, there's no hair here. But the main point is there is also this other thing. It's not EEG. It's a part which is basically goes around your head. I don't know. It's called something else.
Transcranial magnetic stimulation. Is that what?
Yeah.
MRI.
No.
Probably
What they do is that they can actually measure it without having things stuck to your head, these so to say, these little sensors or something, electrodes, yes, thank you. They have that. So that's already, right now, a clear understanding that your thoughts or whatever that goes out, waves and so forth, does not stay inside. It goes also out. Is this also, because we're here, and you were two pros, so to say.
Well, to just clarify a couple of things, the reason that, if I gather your thoughts correctly, I mean, the reason they're able to capture signal while not putting on electrodes directly on your scalp is not because they're capturing anything outside of the skull. It's more that the way that the signal is captured is actually through the creation of electric or magnetic fields. And so the idea is that we are still measuring measures of the brain inside the skull. But it is just another way of capturing information that was not necessarily accessible before. Yeah. But I think something that you brought up philosophically is actually even more potentially interesting, is the duality that I think a lot of people working within and outside the field maybe sometimes don't differentiate, is that we have this illusion that there is the brain and then there's the mind. So sometimes even I've heard neuroscientists talk about the idea that, you know, we study the brain, but the soul exists somewhere outside, you know, this holistic perspective, which is obviously correct, but that we perceive it as separate aspects. But the point is that the mind is kind of what the brain does. So anything that you would be able to perceive, any type of construct of reality, is created by your brain. And so I think on the one hand, it could seem like a very cynical approach, seemingly saying that there's nothing beyond the brain. But I actually think that it's potentially a very positive perspective, because what it shows is that whatever psychological experiences you have, they do shape the brain, and they do physically affect the way that your brain looks, and vice versa. The way that your brain physically looks and the way you were born and the way it changes will affect identity changes over time, will affect the way that you perceive the world as well. So I think there's nothing necessarily cynical or sad about that fact, but just that there is not necessarily a separation between the two, like the mind being just inside the head or so on.
Yeah, I actually agree, and I would like to comment on this, because maybe previously people would think that neuroscience is basically like medical, very brain-based, but what brain does, it actually makes us who we are. So all the emotions, all the feelings actually are the product of our brain activity. And I would just also like to add another variable to this brain and soul duality is the body as well. And brain is not able to function on itself, and there is a huge part of science that is now looking into this brain and body connection, and this is also very, very important. So I don't think anything is exclusive, it's all holistic, it's all integrative together, integrated.
But one thing that I'd like to add to it, because that we give labels to things to understand it, to be able to point it out. Okay, what you said, Emile, about the mind. Okay, and mind could be understood a little different for some and different for the other. To basically be on the same paradigm, so to say. A lot of times you say, what is the mind? You know, mind is the soul, there's the spirit. Mind is you, mind is the field, mind is... Okay, let's get straight. Which one are you talking about? Okay. And in your case, basically, definitely, we're talking about the brain and what it does. And one other thing, an example that I always give, you could be having a little accident, or maybe, you know, to sprain your ankle or break your leg, you know, and then, you know, you go through the process and you get healed. You do then physiotherapy, so forth. But if something, and you're still the same person, right? But if something would happen to your mind, to your brain, you get a hit, you get a concussion, you get, you know, and there is also this thing, which I just forgot the name of it, you know, some people that become geniuses after they get hit in the head, you know, something happens there that they see everything completely differently. It has a name, but I forgot the name. I'm sorry.
Sounds like a refresh button.
Like a refresh, or basically some people that had certain accidents where they begin to, they were never in maths, they were never in physics, and all of a sudden they saw things and they started getting very interested in certain things which they never got interested before. You know, a genius click, I don't know, whatever it was. Anyway, so coming back to what I was saying, if anything would happen to the brain, the personality, the person changes.
Exactly.
When you break your leg, it's a leg, okay, you have the pain, it goes away, you're still the same person. So the head of command, so to say, command center as we know it by now, with integration with all the rest of the body, because as you said, they're all interconnected. Okay.
I think that's very important to emphasize. I mean, that's the reason
absolutely.
A lot of neuroscientists and psychologists choose their field, because we think that, you know, that's the seat of all of us, what we are at the core. But I do think it's important to note, I mean, stuff that we were talking about, the body and being related, and like the gut-brain axis and so on. But also, I mean, even your leg hurting or something does have tremendous psychological effects, and those psychological effects will change your brain. So actually, yes, your brain was not directly, you know, damaged or so on, but I think there is still a lot of misconceptions about what things actually do affect the brain. And it is not only that you cracked your head that it necessarily needs to be affected. I think a lot of things in our environment that we sometimes would not think of, potentially mental illnesses, psychological challenges, especially early childhood experiences and things like that, the extent to which they will impact our long-term, you know, psychological outlook and truly identity.
Yes.
But also
the
other way around. Go ahead. Like the psychosomatics, that also works the other way around. Like if there's something happening with your brain, you are going through some difficulties in your life, anxiety, depression, or serious psychological illnesses, then yes, of course, your body will react differently. And that is also the way why we should, I think, look at everything that is happening within our brain and the way our behavior shows it, take it very seriously.
And just an extra thing I just want to say to the audience that are listening in right now, you can write your questions, and I'll do my best to address it. So if there's something of interest for you, please go ahead and do give us your question. One other thing that I also noticed, because I look at the whole body, so to say, that we found out we're getting this information where the brain basically has, it analyzes yes, no, maybe, you know, it begins to have this analytical communication, internal communication going on. But we also get a lot of impulses from the heart, for example. You get a lot of impulses. They found out even what from the bacteria, which is within your gut, which is keeping you alive, by the way. This is good bacteria, everybody. This is good bacteria. Without that, you die. You know, so that is needed. That gives you the energy that basically dissects the food within you and gives that. And sometimes that you have a certain, how do you say, appetite or something that you want to, you know, your stomach, basically your stomach, your intestine, the bacteria are talking to you, say, hey, listen, how about some chocolate? I really need some chocolate, you know, or something that you've never eaten before and you want it and you crave for it maybe. I mean, sometimes it's also that there's something missing, that even the communication goes there.
Yeah.
But it's hard to decipher for the brain what it is, or even sometimes we say intuition, okay?
The gut feeling. The gut feeling. Sometimes we really need to take care of our gut, because the gut really tells us how and what is happening, what is missing, what may be actually going wrong. And this gut-brain connection, gut-brain axis field in neuroscience is now booming with a lot of new evidence coming around about depression and anxiety being related, with the microbiota changes, also like disorders such as Alzheimer's disease, and actually like one of the most important chemicals that is important in depression, serotonin, is actually majorly found in the gut, and the majority of it actually comes from there. So now we need to actually look more broadly into our brain, not into our body, not just into the brain.
And for our audience, it might be just good to clarify, just because Ali was speaking, that this is not bad bacteria. So we have a bunch of different kinds of bacteria in our gut. And it is the balance and kind of the ratios between all of them that matter to our brain, because they're essentially signals of how well the brain is doing. And obviously bacteria are also microorganisms, which means that they also have like side byproducts that could potentially be toxic to the brain. So if you have a lot of toxic bacteria, there's also correlations with that potentially affecting your brain and circulating in your blood and so on. And that diversity in the gut is affected by diet, and things that are really within your hands, that are controllable factors, that are not unchangeable. And so all of the research that we're talking about that is still very much blooming in the field, because we still don't know yet, is being supplemented by the fact that we know that these are modifiable behavior changes that could reduce one's risk for particular conditions or improve symptoms for things like Alzheimer's disease as well. So to bring in some positivity and non-determinacy in these processes.
Yeah, okay, absolutely. Thank you so much. Now that we're doing this, let's bridge it a little bit to kind of my field too. Okay, let's bring down. Just for your information, I'm not a psychoanalyst. Actually, I'm a CBT practitioner. But I've been through all of them, you know, through the studies that we've had. We looked at all different, and then of course we could choose, going to the master's level, which one you'd like to go to. And for me personally, the one that suited me was cognitive behavior, psychology and therapy. Nonetheless, for me, that is so to say a kind of a foundation and maybe some kind of guidelines. But I have added a lot of things on top of it, also from my experience from before, where I see a lot of things fit together, getting information from different sources and putting it together, making my own. And say, hey, this makes sense. This makes sense, because there are all these sources not connected. No fake news. Okay, it's a real thing, and that's why I've gathered that, and I went on also on this mind level, the soul level, so because they all are interconnected to each other. And the best thing to do, to give as a support, as also a therapy as such, is to understand the thing holistically. So where does now the psyche, I use the word, the psyche, where does the psyche come in here? I don't know if it's true or not. I read it somewhere, but I think Aristotle once said, or somebody else, who was it? They said they opened up the body, but they didn't find any soul in there. Just imagine how they were looking at, the understanding of it. So where does the psyche in the brain comes? And what is this thing about the one part, the pineal gland that is there, which is basically is the only one, for the audience, everything, most of the things we have in our brains is double. Everything they have double. And this is one of the few things which is just single. Oh, they say the third eye, they call it, name it and so forth. The yogis used to call it thousands of years ago. But now we're getting to know more about it. So please, I'll just shut my mouth now, and I ask you please to let me know, where does the psyche come in?
I mean, it sounds to me that you've given us the question that Aristotle, or you mentioned, was doing, opening up the body and looking for where the soul is. And now you're asking us, do we open up the brain and you look where the soul is, or not the soul, let's say the psyche is. And so I guess it's a bit of a tricky question. I mean, for us, and we have had this conversation with Laura as well, I mean, the point is, do we need to localize the psyche? Like, what value do we gain from actually knowing where the psyche is? Or is it what the psyche is that really gives it its value? Because, I mean, from my perspective, at least, as someone who does believe that the mind is what the brain does, I think that the psyche is the creation of a lot of processes that happen in our brain that are modifiable, that are changeable, that are formed by our experiences and, our kind of context. And so our psyche is a constructed thing that is constructed on a basis, but it is continuously changing. So it is not stable. So if I were to look at it now, it would already be 1 second old, because it's no longer reflective of the time that I looked at it. And, that's just a physical property of looking at things which are inherently biased. So I think the localization of the psyche is not necessarily purposeful, but what we should really ask each of us ourselves is how we identify our psyche, kind of going back to your earlier question, when we talk of the mind, what are we talking really about? And if your question is, do we talk about psyche as an identity tract in order to understand where a person is coming from in a particular situation, or do we try to draw a particular narrative, or is it a personal question of who am I, kind of an identity question? And depending on all of these questions, neither of them can be localized, but all of them will have very different and very valuable answers each.
Yeah, I would just like to say that I think it's very individual, and everyone can create their own construct of what psyche is, and it really is the product of their feeling, of their emotions, and of all of their experiences. And for myself personally, I think it's really based on what we see, what we encounter in everyday life, and what we get updated from the previous. So basically our previous experiences are changing constantly because we're in contact with new people, new situations. So I would say that psyche is something that is malleable, that is dynamic throughout our life, and it really is dependent on the experiences we get.
I would be interested in your answer, Ali, though. I mean, this is obviously the focus of your study.
From the perspective of the psychotherapist and CBT, I'm personally, I would say, a fan, because I have a psychology background and I'm a neuropsychologist as well. But psychotherapy is something I was always, having on the sideline, but as of yet, not in those shoes, but perhaps in the future.
No, sure. Really, I mean, when there is interest,
your perspective about this question.
No, sure. I mean, there's always a possibility. If their interest is there, you can do that. As many may know, when I went to the studies for psychology, now that was psychotherapy and the whole training, but everything was done through university. This was my second study after 20 something years of working. I said, okay, that's it. This is something that really interests me from my childhood. I finally found out, and I went towards it, and I'm like, yes, it's correct. So that adds something to it. But if you want to ask me where it is, the psyche, I think, as you said, you cannot pinpoint, exactly where, but it's, they're finding out more and more, and this may be something which is going to come up, that the brain is not just, the brain is so many things. And one aspect that we may not have known or cannot measure yet really is it being something as a sender and receiver of some certain vibrations, certain frequencies, and so on and so forth. It does a lot of that too as well. And one thing regarding the pineal gland or pineal gland, I don't know how you say it. They say from the tests that they've done that is basically what they're going to keep on testing on, that what we call as the connection, as this antenna or whatever it is. Supposedly that has a lot also to do with it, and tests are being made, especially also regarding doing therapy, but under controlled system of, and this is still controversial, with psychedelic certain, they call them drugs or whatever, but with that, but under controlled environments, and not for the everyday use, that you do control environment for that purpose, to know exactly the weight of the person, to know exactly the amount of what you're giving, which are you giving, and so on and so forth. And what they found out, I think maybe you can confirm or give your opinion, what happens under certain circumstances, also with meditation and so forth, what they did that under with some yogis under the fMRI. fMRI is functional, so basically it's like MRI, but you're watching the TV live, what's happening there, you know? So that the whole brain, I mean, so many parts of the brain got very active, and the connection between the parts became much more clearer. So when we say meditation, when we say about these other, but that's a controlled environment, you need the professional to support you regarding the psychedelic. But even meditation, even certain things that also we go about daily, and meditation is the simplest thing to do, I would say. And under meditation, I always have to say this, because a lot of people think there's some kind of yogi sitting on nails and going like this, you know. Well, it could be, yes, but the main thing about meditation, it's focus. It's all about focus. Bring down like a laser beam to a focus, and this focus could be within you, with your breath and whatever. And that allowed connectivity between the brain to enhance. And I don't know if this is also what you can say or what you know too.
Yeah, I could personally comment on the part about mindfulness meditation, because I've done some research myself, and I do practice meditation, and there is a lot of science backing up this. But I think one of the most important things is definitely the increased connectivity between the different regions, and this is why it really helps attention, for instance. That's why it really helps to reduce anxiety, stress, and really relaxes. And another thing about the point in the brain being the pineal gland is actually really important for various processes for controlling sleep, etc. So definitely there is a biological and neurobiological underlining behind the theories of the great philosophers. So yeah.
Yeah, I'll just add on to that, again, as Laura said, the connectivity is important because of something we discussed in the beginning, in that all of the parts kind of need to work together all the time for most of the tasks. And the better that connectivity is, the quicker it is, the quicker we'll be able to perform those tasks. And it really helps with something that some of the listeners might have heard of, which is the default mode network, which is essentially known as the parts of the brain that are connected at rest when you're not necessarily doing any particular things. On the pineal gland, you're finding one thing in the brain that, you know, holds more promise than others. I will just, again, resort to the fact that there is a lot we will find out from science. There's a lot we don't know. There's a lot we will find out and need to revise our theories. But I personally tend to be cautious about any types of cure-alls, which would be like finding the pineal gland, which will solve a lot of issues. Because I think that so far, what we've seen in natural history, which we call science, is that usually whenever we discuss something that seems to solve all issues, that ends up to be, at best, part of the story, and at worst, just plain wrong. So I think I would just practice some healthy skepticism when thinking of the pineal gland in particular, though those studies are very interesting. And I think there was an additional point that Ali brought up, which is everything that's related to ego-related therapies, such as psychedelics. When we talk of ego-related therapies, it's anything related to, you know, trying to better understand the self. And something that personally has been very important to me is I used to do research on the sense of self from a social cognitive neuroscience standpoint. And something that we found, which was, maybe a criticism of our science, is that, you can't really pinpoint a self in the brain, because the issue is that the self in relation to other people will always be different. So for example, the self that, not necessarily even in any grand scheme of things that I am a different person when I am with different people, but the way I conceive myself when I talk to Laura, and the way I conceive myself at the very cognitive level when I talk to Ali, for example, is already a different likely construct in the brain that is tied to obviously my experiences with the other person, but it's probably an inherently kind of social construct, and the separate one would exist in my relationship to myself. So I think the question of, finding that self or finding that ego point is really interesting when you look at drugs that especially have dissociative properties. And when I talk of drugs, I talk broadly of psychoactive substances, whether those would be medications or illegal or unregulated drugs. So that is very interesting, because they potentially dissociate that relationship that one has to themselves, which is potentially promising for therapeutic purposes and for traumatic experiences and a lot of the other things that Eddie has mentioned.
Okay. Now, bringing that also in a therapeutic level, it is I give certain how do you say, techniques or tools to people to handle certain things, and one thing which is broadly accepted. And for me, initially, I'm as I say, I have two things. One thing critical, one thing is skeptical, okay? I'm not a skeptical thinker, I'm more of a critical thinker. Because if I'm skeptical, you block everything, you're like, I'm not taking that. Even true or false, I don't care, But critical is like, wait a minute, let me look in. I don't take it, but, give me enough reason to.
I'm potentially open,
yeah, I'll potentially open. So that's the two things that I say, which differ from each other. But I was very critical about this whole thing about this tapping technique that they do. They say it's the meridians that open certain nerves, that it works, and I said, yeah, right. And I saw research on it, and I saw the deep, not only one, hundreds of them, and how they actually do work, and I saw them also in practice. Okay, there are certain parts of the face or the body that they tap, and they go, these are the meridians. We don't know, this coming through energy psychology and so forth, that they're trying that out too. And you go through certain motions, so to say. You say certain things, and you basically tap on them. It's just not just only tapping. And they said later on, by that, certain impulses are made which are direct to the brain, those parts that you tap. And the things that you say basically opens up the blockages, or whatever, how that is. So, I mean, the researchers said with the control group and the other group that it actually does work, that it opens up and it allows this information that you're getting to go through, or a lot of things that are blocked to come out. And they call it very simplified, they call EFT, they call emotional freedom tapping. They tap this. I mean, you can see it all over the place. Sometimes I get very critical, because people that don't know, they go, yeah, do this and love and everything comes to you and do that. I'm like, that sounds beautiful, but I like to have some, hard evidence for that. I'm open to it, okay? And with tapping, I thought it was ridiculous until I saw the studies. And it goes back even from the 70s, I think they started that. How you imagine how it would have looked there, people tapping themselves. Anyway, now they're much more open. So it does actually work. So does that have to do these whole things to do some information, which I also read and so forth, true that this does change your kind of sensations that you get, the feelings that you get, especially when you're under extreme amount of stress? And I did that with myself. I did that with some other ones. And for that moment when we did that, it worked. They felt, and I give them a rating from 1 to 10. I go, where is it? Because you have to rate for yourself. And then they say, okay, it's 5, 6, 7. And then after that, what do you think now? They go, okay, it's a bit less. And the longer they did it, then they did it at home whenever they needed. And it did really affect, I don't know, I was questioning, is it placebo? which also say placebo is what you believe to be true, that which becomes true, which you take it as it is. And it's so clear because in the researches, they're also using that placebo to make sure that the medication actually works, or is it your own imagination? So your imagination does make a big difference in your body, as is clear. So what do you see to this thing about this tapping and these things that I'm actually working with people on that? And works. What do you guys say to this?
Well, I think it's a very interesting thing. I haven't heard specifically or read specifically about the tapping techniques, but there are a lot of things people do in therapy settings, and there are a lot of things people just practice in daily life. These could be just termed, I would say, maybe self-soothing behaviors, certain things, rituals we do to kind of calm ourselves, reduce our anxiety levels, creating routines or rituals. So these are all the things that actually help us to reduce stress, and scientific evidence also proves that having certain behavior routines or habits actually help us. I have not found anything, because this is something new about the tapping. I'm going to be really intrigued to read about it, but definitely calming breathing exercises, that is mindfulness, that in a sense is self-soothing. Another thing is words. For instance, if we have a presentation or something, I don't know, like a talk we have to give and we are really stressed, a lot of people do have the quirky rituals, like, I don't know, like standing in a superposed position, stronger position, just to visualize themselves. So I think it is the imagination, but if that works, then I think that empowers us to do things.
Yeah, I'll just add to it that I personally have not heard about the tapping technique either, but I echo everything and agree with everything that Laura said, that my suspected kind of mechanism of action would be through those self-soothing and repetitive behaviors that has shown very good evidence. And again, then trying to be critical rather than cynical. I just want to mention the fact that the way that statistics works, even in calling things scientific, like science is a way of finding out about knowledge as opposed to an abstract, an absolute saying of what the truth is, which means that it could be scientifically shown, for example, that it is statistically significant that someone gets better from tapping, and that I fully believe. But if it doesn't control for other types of behaviors, like maybe this is the first type of routine practice that the person has engaged in, and if that is not controlled for, the effect cannot necessarily be attributed to just the tapping technique. But ultimately, I'm of the side that, and of the belief that ultimately what we care about is the person's well-being. And if that works for them, whether that's honestly scientific or not, you know, that you can claim true or not, but the ultimate aim to be achieved is for the person to be better. And the reason why it's better to use science-backed techniques is because statistically they will work better for everyone. They're more validated and they are safe. What's problematic with those techniques that are not necessarily effective is that a person might be wasting time doing something that's ultimately not effective at the cost of seeking out more effective and science-backed, for lack of better word, techniques.
So basically, rounding it up, whatever works, and you can see an answer, so to say, whatever works. But that fully...
has to be, just to like just one thing, that has to be in the safety realm. That works for person, not in a harmful way, because there are a lot of things that could work, but they are not the good ways to maybe do the things.
Okay, no.
And also want to simplify without risk on the others.
Exactly, risk of the other. Whatever works, I'll take it back. I'll take it back. The reclaimer. No, not the whatever. I mean, in the context of therapy, in context of science and so forth, when we were trying things out and we see that it does work, especially what you were talking about, Laura, about breathing techniques. This is just blew my mind away, really, because there is, and it goes back to the yogis and so forth. They call it. They have names for all of them. In general, they call it pranayama, they call it. And what it does, it also, because that's our system, we have the sympathetic, parasympathetic nervous system, and one basically, or trying to balance them, that's the best way. But one that when they're in anxiety, they're basically on full speed going, the wrong direction, to calm them down a little bit. One thing that I do also at my sessions, I do give them certain directions and see how it works for them regarding breathing, and there are certain techniques to calm down and I enhance it a little bit depending on the character of the person. Whether breath goes, it goes 3 to 4 seconds goes in and you hold it, basically it's stomach breathing that goes further down, and you hold it, you put a space in between and you slowly breathe it out again. And you do that again. After a few times, I was doing myself, I was extremely relaxed. I was doing this too. So it did actually work on me too. So there is something to that. Now, one thing about our time, we have a little more time left. My last question, so to say, is how does psychological training, therapy, counseling, training and therapy support or enhance the positive changes, or changes? It could go negative too, I would imagine, if it's not done properly. So we've got to be open towards both things. And the client or the patient, they notice it themselves. If it doesn't feel good, there is something wrong, please do talk out, do speak out. Don't think there's a doctor, the guy knows everything. No, always, it's your body, it's your brain, ask, okay? Don't just let anybody in. So how does the psychological training and therapy support or enhance changes in the brain?
So, well, I don't know, I could start. It actually goes all to one of the main things, and one of the main superpowers of our brain is about the neuroplasticity. So all the psychotherapy trainings, they actually focus on usually changing the patterns, changing the thought patterns, and then changing the behaviors. And all these changes actually rewire our brain into a different direction, meaning that our brain is developing new connections and then losing the old, not healthy connections. And this is one of the principles how actually psychotherapy and neuroscience goes hand in hand, and how various neuroscientific techniques such as brain imaging, such as the one you've mentioned before, the fMRI, the TV of what's happening in our brain, actually shows that psychotherapy changes the way the way our brain is, the way our brain behaves, the pattern is changing. So it's not just the thoughts, but it is actually in the structure. So our brain is being rewired during psychotherapy.
Yeah, and something at the more minute level of what Laura was explaining. So when the neurons, so the main brain cells that carry information in the brain, communicate, it is said that neurons that fire together wire together. So the more frequently you practice a particular ritual or a particular healing strategy or a particular thinking strategy, the more it's going to get settled in your brain. And an interesting application in my work, which is mostly in neuropsychiatric disorders currently, which works on stimulating the brain, is something that we notice actually with psychedelic therapy as well. So whether you're using an adjunct that is pharmacologic, so you're consuming a particular medication or an external medication, or whether you're applying, let's say, a magnetic or electric current directly to the brain, it has to usually be paired with psychotherapy or with talking therapy in order to actually reach clinically relevant results. So it means that, yes, I can change that underlying structure, but without contextualizing for the brain what is happening, it will revert to its old ways because it has wired a particularly different way. So even though the particular medication or the stimulation technique is able to reach short-term changes, it has to be conceptualized and settled in the brain through talking, through understanding what is happening, through understanding potentially either the reasons or the consequences of whatever is happening in order to affect long-term change, long-term psychological effects. And also just to caveat it all, so we're all talking about kind of positive slopes, but to what you said, Ali, that sometimes those things are negative. So actually it's the exact same thing for childhood trauma. The problem is that the reason that people with adverse childhood experiences and childhood trauma are more susceptible to later life psychological problems across the board is usually because of the fact of that early plasticity that is very susceptible to negative experiences that does change the brain's underlying structure for a very extended period of time, which is why it requires active reflection and oftentimes externally aided treatment as well in order to recover over time.
I'd like to add one thing to what Emile said. Yes, the treatments that come in various forms, whether they're like therapeutic, like drugs, or they're like stimulation techniques, they do change the brain. But the other very important thing is the behavioral change. And as I said, is very temporary and really restricted to that one session, a certain period of time. But what is really important in the long term is the behavior change. And for the time being, the gold standard, the best thing is the combination of both the medication and the psychotherapy. And that's why we have to actually do that. We have to really try and change the way we think, our behaviors, our thought patterns, and then our behaviors. We're going to be able to do that, but just without the medications. Most of the clinical studies, they just fail to succeed with the same results as when we have the combination of both approaches.
Yeah, the combination makes it definitely work much more efficiently. But one thing that you said, fire together, wire together, to give a brief understanding about this, that you learn things very, to change certain things. It's like training. Okay, when you train, when you get better in it, you become master in it. And sometimes in my sessions, I tell my clients or patients or whatever you like to call, whatever they like to be called, I say it's up to them. I say, if you want to see how that works, write your name. Are you right-handed or left-handed? They go right-handed. I'm like, okay, write down your name with your left hand. They're like, oh, that's weird. I can't even hold it. I'm like, go ahead, write it. And they start writing it. And after I said, keep on, go on. And as they were doing it, from the top of the page compared to the bottom of the page, it was a world of difference.
Yeah.
I said, this is how fast it works. This is how fast it works. This is how your brain is right now. The weird feeling you had initially, that it's now a little better, a little easier, and you write it, you say, yeah, you're right. I said, this is how it works. This is with the thoughts. This is what you keep on telling yourself. You're training it the whole time, and you go into that direction. Because all these neurons are firing together, and whatever thought you have, if you have this already built in, it's difficult initially to get out. But with practice, it will get out. You'll get out of it. Because every time you think of a certain thing, boom, they fire together, boom, you're right there again, okay? But understanding it, first of all, a trigger that goes, hello, you're going there again. That's an insight thing. So that's that. Then you start bit by bit, and then you have the techniques to do that. Sure. Anyway, ladies, I thank you so much for your time. I thank you so much for this wonderful talk that we had. I hope that it was also great for our audience. And what we like to do is perhaps maybe we'll see we have this collaboration maybe once a month that we talk about different things. We'll talk that into details, and that's also regarding neuroscience. And if anybody liked this, please do pass it on to people who you think would be interested in this, and because this is going to be on Tokitus official, so you can also send it to them, and it would be great to have your feedback, your information, questions that you may have. You can have it on Tokitus, or you can have it also by email to hello@tokitus.com. Okay? Ladies, thank you so much. It was a pleasure for me.
Thank you. It was our pleasure.
And hope to see you soon again. All the best. Thank you. Thank you. Bye-bye.
Likewise. Bye-bye.
Bye.
Bye-bye.